All righty, can I get everybody's attention? Thank you so much for being here today at the Policy Council meeting. We appreciate your attendance, and if it's all right with everybody, we'll call this meeting to order. And I am going to ask Ms. Shirley if she would call the roll.
Andy Henny.
Yep.
Sam Gibson.
Yes.
Barbara Buss. Charlotte Whitaker.
Yes.
Keisha Richards. Yes. Cindy Putnam. Brett Anderson.
Yes.
Terry Dunn. Christy David. Yes. Marie Moran. Bill Gibson.
Yes.
Ann Stamps. Michael Burton.
Yes.
Christy Fife. Barbara Wheeler. Here. Don Hollingsworth.
Here.
Bobby Bruce. Linda Pastor.
Here.
Aaron Fox.
Me? Yeah.
All right. Yes. We have a quorum. Next thing on our agenda, if you would, is the approval of minutes from the last meeting. Any amendments that need to be done? Are they good?
So moved.
A motion to approve and a second.
Second.
All in favor say aye. Aye. Anyone opposed? All right, motion carried. Quick and easy. Next thing would be Miss Linnell, update on, we got Miss Jordan.
Yes.
Instead, so we got Miss Jordan here. Miss Jordan, it's all yours.
Thank you. I'm stepping in for Linnell today. I'm just going to take a couple of minutes of your time. You have a conflict of interest policy in your book, and also Sherry has some extra copies of that as well. We are asking that everyone fill that out, even if you have recently. It's hard to keep up with getting everyone submitted, so we would just like for you to sign that for us today, please. And also in your booklet, you will see our dashboards for July and August. We have Live Heat, our new program here for Live Heat has started, and we are tracking along with that. Everything's going well right now on the county office side. We will be going through some training as we start out our new program year. So if you encounter anyone being frustrated with waiting, just make sure they know we are doing the best we can. Our county offices work really hard, and this time of year is very busy for those offices. Everyone kind of floods the doors come October 1st. Does anyone have any questions for me?
The Live funds are not gonna be renewed,
Live Walk will not be
will
renewed.
not be renewed, okay?
Yeah, we all hoped it would be, but it was a one-time assistance, unfortunately. Anything else? Thank you all.
Thank you, Miss Jordan. Next thing would be, on the agenda would be roundtable with Mr. Farman.
All right, I'm going to introduce Holly Williams. Have her come forward and introduce her employee she has here. Holly heads up our aging programs. So we've got a couple things we want to highlight with you today, and she may have a few more things for you as well.
Sure, we always come with documents. I'm Holly Williams. I'm the director of the Area Agency on Aging and Disability here at the Development District. And our department provides a wide array of services to older adults, adults with disabilities, and caregivers. Those are the three primary target groups. I have here, which I will pass around, this is our program guide. It highlights in there each of the programs that we administer in our department. And if any of you would like a supply of these to take back to your counties or to your agencies, please let me know. We just got a large supply of these printed. We also have them available in Spanish now, thanks to our wonderful marketing team and such. So anyhow, please feel free to let me know if you need extras of those. This morning, I have with me a couple ladies in our department. The first one that's going to speak with you is Annie Drew, and she is our family caregiver coordinator. She is in the process of coordinating a large event that we put on each year, so she's going to share with you some information about that. And then Megan Moore, who is our management information specialist and benefits programs manager, is going to talk with you about our Medicare counseling program.
organized. So if you know anyone that needs to, get rid of some of their older outdated medications, that will be available there as you enter the expo this year. The expo helps, come up with match funds for the family caregiver program, which is the program that I do in the aging department. And in that program, we offer, services and support to caregivers. If you've ever had a role as a caregiver, you know it's a very stressful and, overwhelming job to be a caregiver. So we try to offer support and respite to caregivers. Some of the things that we can offer the caregivers are some respite care for the loved one that they're caring for, maybe some like house cleaning, help with personal care or companionship. Also, they have an opportunity to do a voucher worker, which is an appointment of theirs that they find, that can help provide some resources for them to come in and provide care for their loved one. Also the home delivered meals, medical supplies, also connecting them with counseling, things like that are involved in that program. But if you've never been to the Senior Caregiver Expo, I encourage you to come. I've attended for many years as a sponsor, so I'm excited this year to be on the other end and help plan. And we have a great team back there in the aging department that's all pulling together and helping plan this event. So we invite you to come and help spread the word to the area that you're from and invite your friends and family to come. See you later. Thank you.
As Holly said, my name is Megan Moore, and I work with the Area Agency on Aging and Disability. And the program that I'm here to talk about today is called SHIP, and it stands for State Health Insurance Assistance Program, but it doesn't really tell you what we do. What we do is offer free, non-biased Medicare counseling, information, and education to anyone that has Medicare. So we have a busy time period coming up, which is October 15th through December 7th. It's that time of year when every time you turn on the TV, Medicare Advantage's commercials are yelling at you. So we help people compare plans. We help them find the most affordable plan for them according to what their needs are. So we have several events that are coming up through October through December, and that is on the back of our flyer. We will be in every county in the Upper Cumberland, and there is a phone number if somebody would like to make an appointment with us. We will help them compare plans, set up an account with Medicare. We'll help them enroll if they need help enrolling. We also help with filing Medicare appeals. We also help with reporting Medicare fraud. So there's a lot of things that this program can do, and one of the most important things that we do is we help individuals who are low income apply for help paying for their medication. So there's several programs that they might qualify for, and so we assist them with gathering the documents that they need and helping them apply. So we have several roles with this program. We rely heavily on volunteers. So if you know anybody that would like to be a volunteer in your county, we would love to have you. Our phone number, our local number is on our flyer, so feel free to call us with any questions or set up an appointment in your county. Any questions?
I have a comment. It is the best well, it's hard to say it's the best program ever because all the programs are the best programs ever. But this program helps so many of my clients and your constituents and your clients. It's an amazing thing that they do between October 7th and December, whatever. I don't remember the end date, but anyway.
December 7th, yes.
December 7th. It really is. So I have been doing my dog and pony show, encouraging the seniors to check every year, because a lot of times they think, well, I'm fine with my plan, it worked fine for me this year, but it may not work fine for the next year, so
Exactly.
it's a great program.
Plans change from year to year, and next year, there's 24 drug plans. So if you don't know anything about drug plans, and you just go through looking at them, you may not know what to expect if you enroll in one. So we help them compare, we help them understand, and we help empower them to make good decisions for themselves, and empower them to shop around every year and make sure that their needs are met through their health plan. Premiums in next year range anywhere from 50 cents a month up to $154 a month. So premiums change, deductibles change from year to year. The plan you're on now might not be the best one for next year, so we help walk them through it, help them understand, and we will enroll them if they would like us to enroll them. We use Medicare.gov as our tool, so we usually help them set up an account, and every year, we have a lot of them that come back every year, so we're happy to help, and, just tell them to give us a call.
The key is it's unbiased. You have a lot
It's
of
unbiased.
providers that are tied to insurance agents, and they say they will give advice, but they're really funding them towards their product.
That's
They
correct.
absolutely are, yeah.
Yeah, we offer free, non-biased, we don't endorse any insurance company, any agent, anybody, so we're looking at it from a neutral standpoint. All right, thank you.
Holly, do you have anything else from AD? Okay. All right, we've got a few county, coordinators that's gonna come share. I can't remember, Linnell was gonna head this up, and she unfortunately had to step out because of a health issue. Sheila, come on up, who else?
Carrie.
Sheila, Carrie.
Yeah, thank you.
All right, is that the three of you then? What we'll do today, I wanted them to take just a few minutes, come on up here, you can sit down, or you can stand, it doesn't matter. Take just a few minutes and talk about some of the community connections that they work through, through their counties. So we're talking about some of the cooperation that you have with other agencies. They're gonna talk about some specific partnerships that they have. And I want you to think through that from your perspective, being from multiple counties, what do they need to think about? Who else is out there? Because the problem we get into is there's a lot of groups that are out there, maybe new or maybe more at a smaller scale or very specific purpose. And sometimes we just don't know about them. So if you think of some after you hear them talk, it jogs your memory, want to sort of spit that out. We've got county coordinators, I think, from all 14 counties. So you may have one for Van Buren County or a Warren County, and it doesn't matter where you're at. So who's going to go first? Have y'all discussed that?
No, we hadn't talked about that.
I can.
Yeah. They're all fearless, it's fine.
So we have a partnership with our school system in White County, and I'm a mentor at the Warrior Academy. And what that is students that are behind on their credits and they're in danger of either quitting school, dropping out, or just failing out. We have lunch with them once a month, and we tell them about what kind of programs and services we offer, and they talk to us about what kind of problems that they have. And then the school system is more familiar with what we can do for them too, so we get calls a lot of times from the school system talking about, okay, this family has this going on, is there anything that you can do to help with that? It's been a really, really good program to get involved with, because you get more of your services out there of what you can do, and you also get a chance to start out with a student that's about ready to quit and continue to work with that student, and then when they finish, it's just so fulfilling to work with them and mentor them. And then we also have, we're partners with the White County, Friends of White County Animals, and we give out pet food with our commodity distribution. Now that's been a really good thing, because you can't use SNAP or anything like that to buy your pet food, and we see most of the time that the people coming to get commodities, they actually go through the pet food line before they go through the commodity line. So that's been a really good thing. And we have a pet pantry at our office as well. We have a food pantry that we get donations or Ben Longman assist with it, keeping it filled up, and then we use some emergency food and shelter money, which I think Carrie's gonna talk about that to fill it up, but the Friends of the White County Animals keeps our pet pantry filled, and then when people come in to get food, a lot of times they'll get pet food as well. Cause you know, especially the elderly, they will take their food and feed their pet before they will eat. So, you know, that's what we've got going on there, that's our two partnerships.
Okay, I'll go next. I'm Carrie Baker with Warren County. So I'm gonna talk about two different programs. Emergency Food and Shelter is a program that several of us, in the 14 counties have. And this is a federal program. And so, in Warren County, I help people with rent and I help people with food vouchers. So, they can come and see us and they get $100 food voucher to save a lot. That's the way Warren County does it. And then we help them with first month's rent or we help them with past rent. And, that's also based on a poverty guideline that we do. What's your poverty guideline that you're using? 200%. 200%. And so, that's our emergency food and shelter program. You can find out about this. It's run through the paper and it's also run on the radio. And the county executive in Warren County is the board. Also, I have a program called the Community Assistance Fund. And this is where churches donate money to us, other organizations do. We have someone right in front of me, McMinnville Electric, the last 3 years they have gave money for us, and we could help McMinnville Electric people with one bill. Katie Ford also donated some money to us, and we could help over income people with one bill. So you have 2 churches in Warren County that donate to us, and then other people may donate when somebody passes away. They may give us $25. So with this money, we help pay water bills, we help pay rent, sometimes electric bills. So it's a program that we're very proud of.
No, add on that, that's a program that, if I'm aware, is only offered in Warren County, but would be a good service that we could help provide for each community, especially for our faith-based. I know, I'm gonna speak from my own experience, the church where I go to, you know, we're like every other church. On Sunday, about the time they're about ready to let out his service, there always be that family pulls up in the parking lot, they're standing at the door, and they say, hey, we're just trying to get so-and-so, or I can't pay my rent. You've never seen them before, you don't know what their situation is, and seems like I'm always the one they grab because of what I do, and they say, go talk to these people. You know, that would be a program I'd love to see us look at adding in White County as well, where you've got somewhere that you could refer these individuals to, and they can vet them out. Which the good thing is, in this situation, Carrie takes the time to vet out each one of these people coming to them, determine have they been helped before, or is it somebody that's coming time and time again. Also able to say, this ain't the only handout, you know, there's other resources out there, and that gets them with somebody that's trained that can help them navigate multiple programs. So it is a program that if your faith-based community starts complaining about people coming to them begging for money, we would be open to talk about that, see if we couldn't assist with that, or you could just simply refer them to us, you can give us a donation, we can administer it. It's tracked every year, they know exactly where the money goes to, and we do not take a penny out of that. I think I'm correct in saying that. We don't get paid a penny for that, we just do that as a service.
Emergency food and shelter, we get no admin money for that as well.
Yeah, those are things that we just do as a community partner. All right, Heather.
So, thank you for the opportunity to speak to you. As all county coordinators, as part of our LIHE program year, we're encouraged and required, I think, Jordan, every month to report our outreach. And so this is giving us the opportunity to make those connections with our law enforcement, with the Chamber of Commerce, with the employees and employers in the area. And I'm a part of a benevolence group here in Putnam County. It's probably got about 15 members, 4 of our largest churches, Helping Hands, the Chamber of Commerce, the Habitat for Humanity, Highlands Residential, Vocational Behavioral Health. Helping Hands is one of the, it's singular to Putnam County, but I'm sure there's lots of organizations across all 14 counties like that. But we have a good, strong relationship so that if somebody walks into Helping Hands and they've already asked for help, they're 2 times a year, once every 6 months, they can get help there. So they come in month 5, but their board of directors or advisory board says they can't get help until the next month. She'll send me an email, I've got this family, I'm sending them to you, so those connections can help us. The benevolence group is so very important because you'll have families that'll have a circumstance that puts them at a higher vulnerability rate. So you've got someone that's behind on rent, they're gonna get evicted. Well, they're behind on rent because they've had a stroke and they're in the hospital, they're in a coma, there's things that we can advocate on those families, because obviously that family cannot be coming to all of the different services in the community asking for help if they're fighting for their lives. So it's really, really important that we are aware of the nonprofits in the area, that we can build a connection and, build that system where we can fill in the gaps and advocate for those families that are unable to advocate for themselves. So whether they're, falling through the crack where they can't ask for help and they have justifiable need, significantly, to be helped. And so those partnerships with our school systems, there's 4 major churches that sit on this benevolence board. We meet so how it works is somebody will present a family for our monthly meetings, and they advocate for that family, and then everybody else in that benevolence group will say, I can do food, I can do rent, I can pay utilities, I can help with that medical bill. The CRMC Foundation has been critical to this group because most of them do come with $7,000 to $8,000 of medical bills that can't be paid, and so that I call on that foundation often to help relieve those burdens so that they can pay their rent, so that they won't get evicted, and keep that snowball from everything else helping. So please make us aware. Each county coordinator, goes monthly to outreaches. Please make us aware of any type of community event, so that we can do an outreach for you. Are there any questions?
Does anybody have any suggestions, any groups, any things going on in your county or where you're from that might be good for them to know about? Suggestions? If not, if you think of it later on or come across something that's going on, be sure to tell them to reach out to the local office for UCHRA. We want to be involved and see if we can't partner with it as well. So, thank you, ladies. All right, the next thing I was going to bring up, and it's not on the agenda there, but I just wanted to keep you updated. We're getting ready to submit the state of Tennessee, like multiple other states across the United States, was part of an opioid settlement lawsuit. And Bill, you probably could give more history on this than I can. But what has ultimately happened is a lot of our large pharmaceutical companies, or the pharmacies, they were part of a lawsuit where the state then is getting a large sum of money for remediation of those issues that's caused by the opioid, the overdose. So the state has, I think, roughly for the next year, $40 to $50 million that they're getting ready to distribute across the state of Tennessee. Just to update you, we have been working with a couple nonprofits, also with Vanderbilt Medical Hospital, to submit. We're going to be submitting an application to cover all 14 counties, to build sort of an ecosystem where you have boots on the ground in all 14 counties, and then also working with our doctors and our health departments to try and reach individuals before they get too far along in that addiction issue. So we're going to be submitting that probably within a week or so, and it's going to be roughly a $4 million grant over a 3-year period. So that is coming. We'll talk about more of that. We're crossing our fingers. Bill, are you putting in for it as well?
Well,
I figured you were as well. So we're all going to cross our fingers, and we're going to all hope that we get some of that funding. So just want to update. Now, I need y'all's help a little bit today. I want us to take a little bit of time. A couple of years ago, we come out with the Empower program where we're tackling poverty at the family level. There's getting ready to be a second wave of funding come down for the state of Tennessee. That was part of the Tennessee Opportunity Act that was passed by the General Assembly roughly 2 sessions ago. They have set aside money, and they're getting ready to do another push. Megan Spurgeon, a couple more of the Empower staff, and I had the opportunity to go and attend a conference that the state held last week in Nashville, and it has to do with fatherhood. And, you know, if I had Megan get up here, and we've been tracking our numbers for all the families. And we're, how many families, Megan?
390.
390 families that we are actively working with them. And correct me if I'm wrong, roughly 75% of those are single moms. They're raising kids on their own and have no support by a male figure. That's gotta change. We're never gonna be able to break that cycle. We're never gonna be able to get to where we need to be. The state of Tennessee realizes that. Commissioner Carter, Governor Lee have realized that. The General Assembly has already got on board. And they realize that they need to set aside a pot of money to work on the fatherhood issue going on in Tennessee. And it's not just Tennessee, it's like everything else. It's a problem across the United States. Now, when you look at that group that was in Nashville last week, there was a lot of people from out of the state of Tennessee, but most of the ones from Tennessee were probably more from West Tennessee. You get over to Memphis, Jackson, that western side of the state has been working on fatherhood issues for several years. I don't know that we've been doing that. We've not done that more in Middle Tennessee and more eastern Tennessee. Now, maybe the larger cities like Knoxville, Chattanooga, Johnson City in that area, they may have worked on it. But we've got a huge issue, and the state is rolling out a 5-year strategic initiative, which they're putting money behind, to do messaging, to do programs, to improve their policies, and to do research and innovation. And they're actually rolling out a 3-tier grant program to come out at the end of this year or the first of 2024. One of them we would not be involved in. It has to do with the research and the evaluation side of it. That would probably be universities, those type of institutions. They're doing a messaging campaign, which I've talked to Avery Hutchins over at WCT. They might be interested in it. Some larger scale marketing firms might be looking at that. But they are getting ready to roll out a very substantial grant program on how to tackle the lack of fathers in the home today. And had the opportunity to meet with Commissioner Carter and have a good conversation with him. You know, we've sort of led the ground and led the way. We brag all the time with our 390 families in our Empower program. Compared to Nashville and the larger urban areas, we're hanging right there with them. So we are sort of setting the pace along with our larger areas. And Commissioner Carter said point blank to me the other day, you're proving that you can do this with families. We're going to count on you to see if you can't figure out a rule model to try and tackle the fatherhood issue. So I feel like that we've got a very good chance to, if we can come up with a good program. Now that being said, we've got to come up with a program. And I want you to think, I want us to just take a few minutes. Every one of us in this room has had a dad. I don't think scientifically we've evolved to where there's nobody been cloned in the room. Marie, you weren't cloned, were you?
People suspected that no.
You know, with AI and robots and stuff, there may be in the day and time we wonder if somebody's a robot or not.
Yeah.
We're not there yet. So with that being said, every one of us has had a dad in our life. Some may have had a dad that was more active. Some may have had some that weren't so active. The question I've got for you, if you think about your home community and the people you interact with daily, what would be a few things we need to start looking at to develop a fatherhood program? What would be some suggestions you have? All right, Misty. We should introduce Misty Fye is our brand new member. She is, now you technically live in Putnam County, but you work up in Overton County at the Drug Coalition.
At the
Recovery, I'm sorry.
next to the coalition.
We're excited to have Misty on here. As we know, Misty has a lot of ideals and growth, and she's going to be able to be a good addition. What's your thoughts?
Well, I've been looking at this issue for a long time with, like, restoring the family model, and I have, personal lived experience too, and currently have two fathers that are not involved or very engaged with my children. So, but a big thing I see with my clients and just in general, a lot of them are dealing with addictions or some kind of a criminal background, and they're getting those needs addressed when they get involved in certain programs, but there's a lot of them that are not involved in any programs. There's a lot of them that are walking or riding bicycles around town, they don't have transportation, they don't qualify for insurance, so they can't get mental health care. There's just so many different things to meet their needs that, because they're not the single mom or the single parent, they don't qualify for assistance. They are still required to pay child support, and that's, some of them do it, but they can't really get ahead because of that. Some of them aren't doing it, and then they're going to jail, and then they get out of jail, and then they're trying to find a job, and then they end up behind and go back to jail. So then they never really get anywhere with that, and they just stay in trouble.
There's something they mentioned the other day, I didn't realize how much state and federal policy goes against the fathers in that situation. And one that's talking, you're talking about child support and transportation, if they get behind so far on their child support, they're taking their driver's license away. Well, how do you get to work if you don't have a driver's license?
They do even a restricted one for
Yeah.
that now. Used to, that was the case. But that seems to be like a big discourager that I'm seeing a lot with the dads. They don't feel, I don't know if they don't feel adequate, like they don't feel that they bring value to the family, and they're just kind of in survival mode right now.
Finding work, when you've been in and out of jail, just finding someone who's gonna take a chance on you. And, you're right, I in my own family, they're riding bikes around town, doing their best, but they don't have a job, and then they get behind, and then they're back in jail, and it's just it's a cycle. And, with my own kids, their father's in prison, and, it's hard to, find male role models, for them. And I think that, that could be an important component if we could maybe, get mentors for the dads, to help the dads learn, how to take those steps.
So I did do that for a couple of years. We had a peer support group, and we had several dads that would come and attend the meetings, and we had ones that had already been through several, a lot of the same challenges that were kind of mentored. We just didn't have the funding or the manpower to keep doing what we were doing. But I think if we did on a larger scale, like if that gets more people involved, they seem to have the willingness. I know TDOC was sending referrals, and quite a few of them were attending, meetings online, and I think they're willing, but they just don't see the hope or the way out. They don't have the direction.
Talking about prison and those situations, they threw out a statistic, and I'm assuming all the statistics they told were correct. But if you're in a traditional family, mother and father in that two-parent household, I think the statistic was you were twice as likely to go to college than you were to go to prison. If you're in any other situation where it's not a mother and father, your natural mother and father in the household, you're twice as likely to go to prison than you are to go to college. It's absolutely flipped. All right, Michael, what if the guys you got coming through your program, what would be something we might could do to work along the fatherhood side there?
Well, I think kind of what they're talking about, some peer support and, maybe some parenting classes and things of that nature. 'Cause I think a lot of them, from what I've seen, is, they didn't have a father in their life, they didn't have a father in their life. I think some of it is they just accepted, well, that's just how it is. And, that cycle needs to be broken. But, I can remember several years ago, jail for, about 27 years total. And I can remember when I worked misdemeanor probation, going to general sessions courts all the time, and watching those families, moms dragging the kids in the courtroom while dad's in jail and getting sentenced. So, you know, a lot of that over the years has kind of went away. They don't let the kids in there so much anymore, but I kept seeing that, thinking, you know, they grow up thinking that's just normal, seeing dad in jail. It's normal for dad to go to jail, be gone for a few months, come back home for a while, and then he's gone again. And, you know, that's, I think a lot of the problem, with a lot of things these days is the family's broken down, and, they get in that rut and can't get out of it, and it just keeps going after generation after generation. You see it?
Well, does anybody have, do you know of a program anywhere that's been successful? Teresa?
I just wanted to share that you may want to touch base with Centerstone. They, several years ago, had a program, this is not a good initiative. And I know that they struggled to get workers to actually go and do the program. So I don't know that it's actually still in place, but Centerstone did show the vision, and it was here in North Carolina.
Okay.
I know.
So that maybe some ideas of, I'm sorry, that, you know, what they did and what was successful, and maybe, maybe there's a better outlook, maybe it's the timing, so it may be a jumping point to you, because they already have programs and initiatives in place. That was fun.
And if there's a program out there that could be set up, like if it was online or something, we've just got some, computers in our office, and it's not completely set up yet, but, we've got a classroom there, and we've got some computers in there, some audio, video stuff. And if there was a class set up where we could refer them, or it's online, we could actually bring them into our office and let them attend it in there together. Of course, they can come over there, you know, if they want to do it in person.
I think that, a lot of them struggle with like this feeling of they know, or they feel like they should be providing for their families and they're not, and there's some pride, and there's like, they're afraid to go ask for help in these programs. I don't know if there just needs to be more of an incentive, or the fear factor get eliminated, so they don't feel like they're looked at as bad because of the situation they're in. But a lot of them will know the resources that are out there, but they won't. You can't get them to go join the program and sign up. So maybe just stigma of that kind of dealt with.
Let me ask this, is anybody thinking to themselves, a group in your community or wherever, somewhere where you know, that might be interested in working with us on this? Can anybody think? I'm thinking the trauma-informed community group in Cumming County, when I was there, that you think about them. Anybody else think about any other groups that might want to be involved in this?
Impact? Impact?
Impact? Okay.
I would think a lot of your faith-based,
Maybe some men's Sunday school classes?
Men's groups are already out there that in the state of Missouri, there's a federal grant done through transportation that partnered with Department of Children's Services, and foster care, where they implemented a system where they provided the transportation and then grew into counseling and peer support and all the other things. So it was really centered around transportation, where you have someone that gets, through recovery court or released, and their children have been taken out of custody. And so it's a reunification where they didn't have transportation to get a job, they didn't have a job to make money to, so it was like the ripple effect of all of the different barriers. So they weren't meeting the qualifications to get, back together with their children, to gain custody of their children. So this was a transportation grant, but they partnered with Department of Human Services, Foster Care, and, I'm assuming the Community Coalition, that we are a part of. That's why I know about it. But that would be a great, study to see how, the foundation of that, how that grew.
I would say, just to kind of piggyback on what you're saying, as part of the children's services here, oftentimes families have to do a permanency plan, they have to have parenting classes and so forth. So there may be something, a partnership there, that families can have, either a class or something, or a series of classes, or mentoring on fatherhood, to help those parents too, because usually it's like parent specific, and a lot of times it is the single moms that have to go to parenting classes, but there are dads in parenting situations as well, as like who that family with, how do you talk to that?
There's a lack of motivation among a lot of the younger age fathers. And that seems like one of the toughest pieces is like, they get under a child support order, they don't really want to work, they play video games, and get by sort of, stomp out the closest fire maybe, and it's just, I don't think it's gonna motivate them to want to do better.
Well, I'm glad you brought that up, because one of the things they talked about in this conference is this isn't just about fathers. It's about the mothers just as much. And from a couple different perspectives. The mothers have to know and understand and be worked with to understand the importance of having the father in the children's lives. And even though there's disagreements and there's a reason why they're divorced or not together, they've got to figure out how to work through that. So there's a component for the wives as well, for the mothers.
Yeah, that's absolutely true.
The other thing, going back to the media campaign side of it, there's a natural, I can't remember what the term was they used. There's a natural, it's the succession path or something, and you look at it, you need to graduate high school, you need to have a job, and you need to have a strong foundation of a relationship before that child ever comes in. And you think in our day and time, we don't teach that anymore. We don't teach that progression, that you gotta get that high school degree, you need to get a job before you ever think about having children, or put yourself in a position where you're gonna have children. Think about the path you need to be on. And from a media campaign standpoint, that's one of the things I was talking to WCT the other day, how we could possibly build one for the Upper Cumberland, just reinforcing that message. If you have a child while you're still in high school, your odds of getting out of poverty is such and such, and work your way through is so what that can be, or what it needs to be. All right, I'm gonna throw a curveball out here, because we were brainstorming the other day, talking about the marketing campaign. Who is some of the big names? We put together a campaign where we wanted some of our most famous people, sort of as the face, to be that, talk about fatherhood. Who are some of the most influential, famous people that we have in our 14 county? Besides Mayor Head. Jay Coot, all right.
Good father.
D. Prince.
All right.
I think Colby Lane is one. I think he touched a lot of people.
All right, what about from a famous standpoint?
Bob Bell.
Bob Bell.
Bob Bell.
Was he a pretty good father?
He's an amazing father. And he didn't have to be an amazing father for me, he's my stepfather.
Well, we were talking about probably President Oldham, but Ted, of course, that's where President Bell was prior to him there. We were talking about, it's our CrossFit guy.
Oh, yeah,
Rick Frawning.
Yeah.
We got Vincent Daly.
You need to find people that, the fathers that you're trying to reach will see, and no disrespect to the people who've been mentioned, but you're not gonna have a connection with most of those. And so there's nobody I'm just saying, that Vincent might be dual, right?
Yeah.
Talk about how important a father. Coach also, I know Coach, he's not famous, but he can absolutely be famous, but they could connect to him, big time, because he's been there, done that.
What is the name of the minister, I think maybe at Life Church, who's a
Bob.
recovering addict and?
Bobby Davis.
Yeah.
A lot of people know him. I'm trying to think of somebody huge. They're out there.
They're not gonna respond to someone who doesn't look like they've struggled on their walk in life. They need somebody that looks like they went through it and figured out how to get their motivation, how to overcome
Lived
it.
experience.
Unless they're superstar. I mean,
I never find me to hear Charles Stanley pass away. He's a good guy. And he tells parents how to take care of the children and, you know, respect the law and all, you know. If you think you get above the law, you're lost.
the Jack looks good too. I like Jack. Cause he's younger.
Didn't he have a daughter too?
Yeah, he's got
He was a
kids.
single parent for a
Yeah.
period of time. I don't know if he's remarried, so I'm gonna,
Yeah. He has.
from the voice. As well as theirs.
Who, or Warren County, who out of Warren County would be a big one?
Just trying to think of,
It comes to mind at the moment, but,
He's not a father, the biggest recent guy is the court, or the guy that plays at Vanderbilt, that is not a father, you know, the football player, that is not a father.
But you could also have the person who is successful
Maybe
and
it's
a father may have played a huge role. I mean,
or
I look
a
at,
role model.
right, I mean, I look at Jamie Davis, he doesn't have any kids, but his dad was so instrumental in becoming the man that he is today.
Coach Dalton was pretty, the gym was named after him, and his son is wasn't his son also the TBI agent?
he was, yeah.
Yeah, that family, I think, is pretty, known in Little, he was a TBI agent. His dad was also the basketball coach. His gym's named after, that's somebody I would think of that was a good father and a role model.
And I think just like she was saying, someone that would be more relatable, you know, to them. Whether with these kids, like as they come up through high school, maybe coaches or teachers or someone they looked up to, you know, that would be who they could relate to.
Coaches probably would be huge.
In the community, right? Yeah.
And all of his information is in the new Black Museum, the historical museum. Anything you would want about him is in that museum. What about online influencers?
we look at it from that standpoint too, like, the people, since most of our homeless, they have phones and things like that, so they're not reading the papers, they're not doing it, so most of their influence is coming from online. So, like, is there any standout online influencers that we could look at to be like, they're looking at them, can we pull out the ones who are changing fathership or fathers, sorry? Just on.
You know, something kind of similar to what Empower's doing with the circles, but like if there'd be something that the men, not the younger, the youth, but like the adult men could have almost like a big brother mentor type person and connect with somebody else in the community, like elected officials and other just, you know, members that could take the time to meet on, take them for coffee, or go to lunch together and just actually get to know them and know what their battle is. You know, they're more likely to respond to somebody that'll sit and listen and just take that extra time with them.
I don't wanna belabor this, but this has been a great conversation, there's a lot of notes there. Just keep in mind, moving forward, we're brainstorming right now what this could look like. If you go back and you think of some group in your community that might be interested in working with us on this, I mean, I would love to build a partnership like we did with Empower. It may be the same members, it could be a different set of members. But we need multiple groups working on this together. It needs to have the faith-based community as well as government or nonprofits. So, if you can think of anything or you see a program that might be good for us to look at, pass that along.
I have a suggestion.
Yeah.
I've seen some, that in Fullerton County, but they're also inviting to come on, and several other countries, counties, they've expanded, but they have a parenting program, an in-home program. So maybe that would be a partner, or, with other initiatives as well.
I was gonna say, we also might wanna think broad, zoom out a little bit and think of like spokespeople, rather than local, maybe think of somebody that's more well-known nationally, that we could get some messaging.
Well, some of the discussion was maybe getting like the, country music stars, doing it from a statewide, the state might do a push like that, and country music stars, like Tennessee Titans and stuff like that, where you would have some really big name celebrity type.
Some of the dynasty guys.
Peyton Manning.
You almost need to have a focus group of young, men that are fathers.
Listen, that's a great idea. And
Who would embrace you?
This is a 5-year plan, but just what I'm thinking too is like when you mentioned it a little bit of youth, to try to program for, those like in the high school age, in college age, that aren't college yet, but are soon to be, or in the future, like what that looks like too.
There used to be an abstinence, program, and it wasn't sex education, it was like, here's, if you father a child, here's how much it's gonna cost you, and here's, like a lot of awareness of the downside.
Yeah.
I think, I've got a 14 going on 15-year-old boy, and I have conversations with him like that where, he'll be like, well, I can work at McDonald's, and I'll be like, okay, let's say you get a full-time job at McDonald's making this much a year. And let's look at rents, where they are right now in Cookville, let's look at car payments, let's look at insurance. And so let's look at the reality, you're not gonna be able to support yourself, much less a wife, a partner, or children. And if we can get them, young enough, even, to try and halt that, like you say, the abstinence, because we're just not saying, hey, don't have sex, we're saying, hey, if you do, this is how your life is gonna change.
Maybe we should interview some of the dads coming out of the child support dockets.
Yeah.
After they've been held in contempt.
It's not a bad idea, yeah.
We were talking about this, we can identify, we've got 390 or 75% of that 390 that's pool. You're dead on right. You've got places you can go and identify and reach. It's just a matter of having a program that we can get them interested in and be a part of. It's probably not going to be hard to find them.
No.
Just we've got to figure out how to help.
And the child support, they are doing some program changes there where they're offering assistance for those that are paying child support.
I think the UT they're in our office every week, and it is where they're helping them get out or pay their child support for their system they're going through. Is that what you're talking about? Yeah. You see a lot of, they get kicked out of it, but there's a lot of good things that is given to them, good incentives for them to get caught up on their child support, be in the children's lives. But that's coming out of UT. Yeah, UT Extension, because the director that was in our office last week, I guess, was seeing what was going on with our program that the girl there is doing, but they meet in our office.
Extension would be a good partner to reach out to, because they're in every.
They can't pay their child support, but like, they can give them gas cards or pay their rent to where they can maintain their child support.
And they also can help them get off the attachment orders so where they're not going to jail while they're trying to get into work.
Right.
I do think that there's gonna be different ways that you're gonna have to attack this. It's not gonna be a one-prong, it's gonna be a five-prong thing. Cause I do think that you ought to be teaching in school what the consequences, that's not a good word, but reality. Yeah, you've been a young parent. I was a high school dad.
Yeah.
So I've been there and done it. And there's a reality that comes with that. You grow up pretty fast. But I'll
Maybe you
see.
should be our celebrity dad.
No, I'll see. Well, I grew up in a single parent home, but my dad raised me. with the help of the grandparents. But the other aspect, you gotta get the mom and the dad working together.
Yes, that is so huge.
You brought that up a minute ago, and that's not gonna fix, that's just a prompt, but one of the 5 or 6, whatever you come up with, but it's so important because, I'm telling you, dad's gonna pay child support, mom don't let them see the kids.
Yeah.
The dad loses an incentive to work and try to build that bridge because he can't see the kids no matter what he does. I see it all the time. That's this part of this, but it's still a part of that.
Amen to that, amen to that.
Yeah, and the mom and the dad both have to understand how important it is that the dad's in the life.
Absolutely.
So,
The last time my kid's dad was around, I saw him walking down the street, and I stopped, and I said, you know, Joe, are you gonna come and see the twins? Because my boy especially misses him. And he said, well, I can't. And I said, why can't you? And he said, because Reba, who's their birth mother, my niece, said I had to go through her for all visits. And I was like, dude, I'm their parent, I'm their legal parent, you know. But the story is repeated over and over and over again in these homes, unfortunately.
We need a co-parenting class too, to speak to what you were talking about with the parent, the father's not being present. They need to know how to co-parent, how to co-communicate, how to co-plan, you know, financial, all the things to meet the children's needs. Because they're disconnected, they don't have to reconnect to solve that problem, but they have to navigate how to co-parent together. Yeah.
yeah, and by no means, the ladies here get offended. I'm not saying that the dad, he needs to carry his weight and be a dad, okay? But he gets weaponized with the kids a lot of times, and I see that being in the faith-based, you hear it all the time.
It's true.
I don't get to see my kids, I'm gonna quit my job, I'm gonna quit paying child support, you know? Cause I don't get to see my kids anyways. I'm not paying her child
Or
support.
you have a family unit where the parents are one's using the drugs, I'm not paying child support to support their drug habit, and mom's got a problem, and he's very right, there's a lot of that. Moms feel entitled,
They do. I've seen dads do it too.
dads do it
I've seen
too.
dads do it too.
I don't believe that, moms don't need to teach their children, they need to teach them to respect their dad. I had an alcoholic dad, and my mama did, it was no option. He was to love your dad.
No matter what.
He's your daddy, no matter what.
So, like, when I got divorced, we had to go through parenting classes together. So maybe look at a system of where if they go to court, even if they're not married, when child custody is settled, maybe put in then that they have, because I don't know if you just go for child support, if you have to take classes at that time. I know when I got divorced, which was 4 or 5 years ago, we had to come here to Cookville to take our parenting class. We had to be in the same room together, so I mean, but it was fine. But I don't know that there's a parenting class just for child support, so maybe somehow attach that.
That's a great idea.
Yeah, I like it.
Yeah, that sometimes the court system, and I don't know if it's recovery court or what, will forgive $10,000 or $15,000 of back child support, you know, because of their incarceration or mental illness or some kind of thing, but then that mother or the other parent the child is the one that suffered in that, so we should look into that and find a co-parenting class, I love that.
That's a good idea.
Let me close with one, more caveat I put out there. We may be the right organization to go after this funding, we may not be the right organization. If there's another group out there, send them our way. We don't have to be the lead applicant on everything, so we're gonna step in if nobody else steps in. But, if you think there's other groups that might be interested, might be better suited, make sure they reach out to us. We will support them just as well as be the one that actually writes and goes after the money, so.
Good deal.
Ginger will amen. Is Ginger back there?
Yeah, that's the first person I looked at when you said that. I bet she was thinking about, thank
She
you.
pulls her hair every time I say I'm writing a new grant.
We don't need no more. Anything else about the fatherhood monumental task that can be handled? We got any old business? New business?
I would like to make you guys aware, I believe I spoke with Ms. Heather earlier, as of the first, Cumberland County, the Crossville Housing Authority has shut their one-bedroom, list down for public housing in our home program. So we've had other towns, reach out to try to get homes, we just want to make you guys aware, that way, if you go back and get flooded, that's, we're not allowed to accept any applications for those.
Is that for all 18 counties?
That's just for Cumberland.
Just for Cumberland?
All righty. Any public comments? Okay, entertain a motion to adjourn.
So moved.
Second? Got a second? All in favor say aye.
Thank
Any
you
opposed?
very much.